Hi, welcome back. This is Lupita Martinez, and I'm a licensed marriage and family therapist working for the Peninsula Center for Children and Families. And this week's video is actually very important to me because we will finally be diving into mental health illnesses in order to reduce some stigma. In my previous video, I had discussed mental health illnesses, but hadn't really gone into detail with what that meant. And this week, the focus is on anxiety disorders. Did you know that anxiety disorders are actually the most commonly experienced psychiatric illnesses for both children and adults? Anxiety disorders are twice as likely to occur in females than they are in males. But regardless of whether you're male or female, some of you watching this video may have experienced some of these symptoms at one point in your life. According to the National Institute of Mental Health, an estimated 40 million American adults over the age of 18 are currently suffering from anxiety disorders. 18% of the entire American population are currently exposed to and affected by anxiety disorders. That's a lot. The worst thing is that only 1/3 of these people will actually seek help, even though these disorders are highly treatable. So how do you know that you've been experiencing an anxiety disorder this whole time? Here is a long list of symptoms that some of the people that have been experiencing anxiety disorders have reported in the past. They've mentioned numbness and tingliness all over the body. They've also mentioned some sort of chest pain or pressure in their chest. Or they've complained of headaches or having some sort of neck tension. Other people have recognized that their stomach sometimes gets a little upset or they get nervous stomach. Others have felt a pulsing in their ear or some sort of buzzing in their ear. Some have even identified a burning sensation all over their bodies and their arms where they scratch and they scratch until it becomes some sort of a skin rash, and sometimes is even confused for an allergic reaction. Then you have people that report feeling nauseous, start to tremble, or feel a shortness of breath where they can't really breathe. Some report a weakness in their legs where their legs feel like jello, or an increase in their heart rate. Some have even noticed that they are not sleeping as well anymore. Maybe they're waking up in the middle of the night, or they're just thinking about so many things all at once and having a lot of excessive worry. Some just feel like they're going to die. These symptoms literally make them feel like they're about to have a heart attack or die, or have this huge fear of impending doom. And others actually feel like they're about to go crazy and like they're about to go and do something that they're going to regret, and there's just all these different thoughts going on in their head and they can't control it. All these physiological symptoms and all these things that I just mentioned that happen all over your body when you're experiencing anxiety are the main reason why they seek medical attention for immediate relief rather than considering going to mental health. It is only understandable that someone would seek medical attention if they're feeling like they can't breathe, or if they're about to have a heart attack, or where they're feeling like they're about to die. But the problem here is that after they're being discharged, what are they doing to really take care of their mental health? That is the issue here. So if you're looking for a therapist to tend to your mental health needs, feel free to contact us here at www.peninsulafamilies.com. And if you're interested in learning more about anxiety disorders, stay tuned next week for our next Fun Fact Friday, where I'll dive into one of the anxiety disorders